a month ago were quite a bit below 1. We are now seeing trends in some regions where that R effective is coming up, that even in some places it's getting greater than 1, which means that spread will become exponential. And all that means is spread will go faster than we wish with COVID-19 cases. Next slide, please. So we really wanted to highlight today, as we come to this final slide that many of you are used to, really the focus on doing what we've done together for a long time now, but doing it with even more vigor over the next many weeks as we see these trend lines, which had been coming down and then flattening, now looking like they may be coming up, and not just over 1 or 2 days, but over the course of a handful of days. We want to sound that bell for all of you to remind you that we want to do all we can to do these things: wear our mask, physically distance, wash your hands, minimize mixing, and please get your flu shot. We know a number of physician practices, health systems, pharmacies have the flu vaccine available. And please, if this is the right weekend to go do that, or next week, please consider adding that to your plans. Again, we are really proud of the slow, stringent blueprint. We have seen movement across our counties, and we want to see us respond as a state to those slight increases by keeping our guard up, helping support our businesses and our local leaders so that we can keep transmission as low as we can while we move into fall, into winter, into flu season, into cooler weather, colder weather, rainy weather, where it's harder to do some of the things that we enjoy outside, and the urge to go inside will be even stronger. So with that, I'll turn it over to reporters for questions. Thank you.
Lisa Krager, San Jose Mercury News.
Yes, thank you, Doctor. There's been some concern about the politicalization of the federal reviews of potential COVID vaccines. Can you tell me if California has any plans to independently analyze some of the clinical trial data, the efficacy and safety data, before it's distributed to the vaccines distributed to state residents? I know at least 6 other states, including New York, have announced that they will, and I'm curious what we're doing, or alternatively, are you satisfied with the recommendations of the FDA's independent advisory panels?
Yeah, thank you for the question. I mean, so first, the advisory panel will do what they often do at the federal level, and we always in California take a close look at what's appropriate for Californians, working closely with our federal partners. But we've already put together a vaccine task force within the California Department of Public Health with multiple other state agencies involved, including plans to put together our own review board that will be made up of some of our leading scientists, our academic institutions, but also inclusive of community groups and individuals who understand what it's going to take for us once we see and confirm at the state level the safety of a vaccine, really understanding how we do the vaccine distribution in an equitable and in a smart way to really serve all of the needs of Californians. So absolutely, that's our plan. It's been in the works. And like other states, we think it's the appropriate approach to take, especially because things are moving so quickly, and we want to make sure, despite the urge and interest of having a useful, effective vaccine, that we do it with the utmost safety of Californians in mind.
Jocelyn Moran, CBS Fresno.
Hi, Dr. Galley. Here in Fresno County, for the first time, according to the Blueprint State page, we're meeting the red tier metrics with a case rate of 6.3 cases per 100,000 people. But I was wondering about this. On the state public table dashboard that tracks cases daily in the county, it has us at a 7-day average of 88 daily cases. And with our roughly 1 million people population, that would put us at roughly an 8.8 case rate per 100,000 people. So I was just wondering if you could explain the discrepancies there and why those numbers are different, and if Fresno County really is on the right path to moving into the red tier. Thank you.
Yeah, thank you for the question. I can't speak to the specifics without the numbers in front of me at the moment. I'm happy to have our team look into it and get back to you. But we do, as we've been watching the data in the Central Valley very, very closely, really concerned early with the increased spread, especially among Latino communities in the Central Valley. We've made a concerted effort working with those counties, building upon the great work that they've established already with some state partnerships to bring more resources and more attention to the spread of COVID. We do believe that many counties, including Fresno, are on that path. I believe that Fresno has met the 1 week criteria for moving on from purple to red. And if things go as they have been, and we all hope they do, they will be advancing from purple to red, but only when the data shows that it can. We have the thresholds for a reason. We believe that they are the right ones, and we're working closely with the counties to make sure that we communicate the accurate calculations on all of those data points. So happy to take a look at any potential discrepancies or issues and be able to explain them clearly to you and others.
Thelma Carlamangla, LA Times.
Dr. Valley, I also had a question about the reopening tiers. I was wondering if you could talk a little bit more about the threshold of 7 or fewer new daily cases per 100,000 for entering into the red tier. I know that's sort of the same thing as the 100 cases per 100,000 that we had before, but I'm wondering if there's something particular about that level of transmission. Why is it 7 and not, say, 5 or 8? Is there a particular experience from California or elsewhere that the standard is based on? And lastly, why do you think that it is for most counties it's that metric and not the positivity rate that's been more difficult to lower?
Yeah, I mean, excellent questions. And I think a number of different states have chosen different thresholds. I think a number of international and national leading experts and thought leaders with COVID-19 response have suggested various ranges. We have and sort of adopted the 7 per 100,000 per day, really mirrored around what our county monitoring list was built around, which we saw as an effective top tier threshold to really allow counties to begin to move with some of their reopening. You know also that the sort of interaction between testing and case finding and test positivity is an important one. And what we do see is that counties that do a significant number of tests may have a lower test positivity, but still finding a significant number of cases. So the real balance between these two is important. And not every county has been unable to move their case rate. We do see the case rate move a little bit after the test positivity. And in some ways that's by design, so that we ensure that as you test more, we find those cases, use those cases to then do the effective contact tracing, supportive isolation to reduce transmission that might follow from those initial cases. So watching all of that come together, it's actually moving as we'd hoped, that the test positivity comes down a little bit sooner than that case rate, and that allows counties to move forward with some degree of confidence into the next tier. I'll remind you that we also require at least 2 consecutive weeks of meeting that threshold, so we can be confident, the county can be confident, residents can be confident that we're allowing a degree of additional operations in our economic sectors under more or less safer conditions.
Dave Manisheri, KCRA.
In particular, the
Hey, Dave, would you mind repeating your question? I couldn't hear the beginning. Sorry. Thank you.
Oh, sure. I wanted to ask about the blueprint for reopening for some businesses. Some have been left out. We've gotten a lot of response from bowlers and bowling alleys, actually, who are saying they've been left out of the reopening sort of schedule. And, you know, they're making the claim that they can bring their own equipment, that they can stay 6 feet apart and put safety measures in place. And the question becomes, well, why are they not listed in there, and when could they possibly be allowed to start reopening when restaurants and other places and nail salons can't?
Yeah, thank you for the question. And there are some major industries that are not yet in the blueprint. In fact, that some industries didn't have guidance put out for their industry at any point. We've been working closely with a number of industries around not just what is the right time or what's the right tier for levels of operations of each of those to enter into the blueprint, but with what modifications and changes. So we're working hard on that. We've heard from the bowling alleys and many of the different venue types that fall into the family entertainment category that is part of the blueprint. And as we hear from those different industries, we're sitting down in earnest with conversations to understand, their situations and really trying to, for those that are not yet in the blueprint, find the right part of that blueprint to have them fit in so that they can have some confidence and reassurance on what's coming and have enough time to plan for when operations may resume.
Claudia Peshueta, KNX News Radio.
Given that LA County accounts for such a large portion of COVID cases and deaths in the state, I'm wondering how concerned you are about recent uptick in transmission and the fact that we've, crept just past 1 on the transmission rate. Thanks.
Yeah, I mean, the whole purpose of today on a Friday, as opposed to waiting till next week, is because we are concerned, not just for LA, but in other places as well, where they're seeing their effective come up. They're seeing their case numbers relative to the amount of testing they're doing come up. Yes, there is concern. We know that we have the tools to do many of the things to reduce transmission, and today's message is hopeful that all of you as reporters will help us communicate that indeed there is concern and we have the tools to reduce transmission. And by doing these simple things, we can hopefully bring these early trends of increase back down and help us get back to where we were just a week or two ago. So absolutely some concern. I think we share that concern, just like the public health leaders and health system leaders in Los Angeles County are sharing. And as I know many of you hear from our elected leaders in LA County as well. So I think it's a collective concern, and that's part of the purpose of coming to you on a Friday, especially before a weekend.
Sophia Bolog, Sacramento Bee.
Hi, Dr. Dowie. I know that you said that you guys think that this increase is due to a number of different factors, but I'm wondering if you can characterize how much of this increase you think is from Labor Day, how much is from the fires, and how much is from some of the reopening that's happened under this new system?
So, it's a difficult question to answer, Sophia. I'll tell you that we're about 2.5, 3.5 weeks out from the collection of Labor Day and our blueprint. And when you start to see cases about this time, this is when we would have expected to see some slight increases. The fires have been something that's been going on for the last 5 weeks at various degrees as well. So it is difficult to break them all out. The timing, though, is expected, actually, that we're starting to see these over the last week. That is, nearly an incubation period after you might see some transmission, give people time to come and get tested. You would expect to see those changes now. And I think a number of our public health leaders were really asking and sharing the point of view that we needed to wait about 3 weeks after Labor Day, after the blueprint really started to take shape, to get that indication. And I think we're starting to see some of that now. I think it was you, Sophia, that asked me maybe a week and a half ago whether we were seeing those numbers at that point, and then we were not. But now we do have concern that these are connected events.
Samantha Young, Kaiser Health News.
Hi, Dr. Galley. I wanted to ask you a bit about the bill signing. I saw that today you were part of the virtual signing with the governor on the mental health bill, and he really talked about moving the agenda forward on mental health. And I was hoping you could kind of give us a little window into the administration's thinking on the healthcare bills and what the emphasis is this year on the bill signing for healthcare, and if there's already themes on cost containment or access, and especially in emphasis of COVID.
Yeah, thanks for the question. And today was a really proud moment. I think the governor, with so much going on, continues to focus on the agenda that we had in January. You'll remember the State of the State was focused around mental health and homelessness, and our response as a state, not to every issue in California, but those important ones that I know he is committed and his entire team is committed to making a difference on. And the legislature, bold steps this year, despite reviewing fewer bills than typical because of the COVID situation, advanced what is a bold collection of mental health bills, not only in and of themselves, but really as a platform of and signaling that we're going to continue to work on these important areas. Mental health issues and substance use disorder issues have only been exacerbated during the pandemic. And so the recognition that we can't just wait for a full legislative season to pass by without making bold moves, I think, is what is reflected today. We continue as my agency and the many departments to push forward, whether it's about individuals with mental health and behavioral health issues in our state hospital system, to the bold idea of doing CalAIM, to focusing on addressing the needs of those facing and experiencing homelessness across our state. Despite the really almost singular focus over the last many months around COVID, the teams that are working on those other issues and pushing them forward, I think really do have the agenda in mind that we shared in January. And there'll be a few hurdles that we have to overcome that we didn't have then, but I think the commitment and resolve is still just as strong.
Final question, Emily Kopp, roll call.
Hi. I wanted to follow up on the question about vaccines. CDC announced it would make $200 million available across 64 jurisdictions for the distribution of a COVID-19 vaccine. I wanted to check in and see if that is enough for you to be able to operationalize a COVID-19 vaccine distribution plan by November 1, or if you'll need more funding.
Yeah, it's an excellent question. I think we will see. We will not be shy if we need more, but we are appreciative of what we'll have to start. And this is going to be a very big effort. It's going to be unlike anything we've ever done. It reminds me, obviously, the closest thing was H1N1 and a massive, very fast vaccine campaign, but it was around a illness, disease that we know well, even if in a different form and people were familiar with. So this one will be different, and the resources needed to do it well for a state as diverse and big as California could be extensive, and we'll be working with the federal government and locally to make sure we have the resources to not just do it well, but do it in a comprehensive and fully scaled way. So again, thank you for indulging us in coming together on a Friday afternoon. I think our key message today is continue to do what helped us get to a lower risk, safer, lower transmission environment across our state. Remember your face covering when you go out. Avoid mixing if you can, and especially in counties where we're starting to see some increase in our opening of certain business sectors, potentially restaurants offering indoor seating. Just use good judgment. Go with people that are in your household. Bring your mask. Support the staff by wearing that mask as much as you can. All of those tools that we have in our toolkit should be used this weekend and moving forward, so we can really bring these upward trends back down and even bring them further down, so we have more space to see some uptick down the road when we potentially have to bring things indoors a little bit more than we do right now. So with that, have a safe and enjoyable weekend. Thank you again.